Hi all, myself Benoselpal from SNS College of Physiotherapy. So today we can see about the spinal tumor. So what is spinal tumor? What are the types of spinal tumor and what are the symptoms present due to the spinal tumor and also management for spinal tumor. So first, so definition. So spinal tumor is a abnormal growth tissues present in the spinal cord. So within a bone or within the spine, and these tumor or these neoplasm or occupying lesions are classified into intramedullary and extramedullary tumor. So in intramedullary tumor, we have present in the spinal cord within the substance of the spinal cord. But extra tumor we have a two. So it's extra tumor we have two types. We are intradural, dural and extradural tumor. So in intradural dural tumor, we are present in the meninges. That is a covering of the spinal cord. So that is called meningioma. So that is present in the present in the meningeal layers, but in the extradural tumor present in outer space of the tumor, that is spinal and vertebral bodies or nerve root that is present in these type of tumors. So spinal tumor classified into two, intramedullary and extramedullary tumor. So extramedullary tumor we have two, intradural and extradural tumor. So classification of tumor in infant extradural tumor, we also have a neuroblastoma, uh, ganglioneuroma, sarcoma, and infant present in the intradural tumor, meningioma, neurofibroma, and angioma, and intramedullary ependymoma. In adults, we can see the extradural tumor is also have a ganglioneuroma, sarcoma, and chondroma. In intradural tumor, we have a meningioma and neurofibroma. In the intramedullary tumor, we have glioma and ependymoma. So in this diagram we can see, so this is the intramedullary tumor. So this tumor present in the spinal cord, and outer space we have one type of tumor. This is covering within the covering of the spinal cord. So this is the intradural extramedullary tumor. And the outer surface of the meninges we have see the extradural tumors. So symptoms we have syndromes, we have three syndromes: sensoriomotor spinal tract tumor, radicular spinal cord tumor, and intramedullary syringomyelia tumor. So sensoriomotor spinal tract tumor, so this affected the sensory and motor function. So we have sensory, we affected only the mainly affected the pain and also temperature. So that's a lesion in the spinothalamic tract. In motor signs, we affected the corticospinal tract. So we have a upper motor neuron lesions. Radicular spinal cord syndrome, this pain radiated through the affected spine, so that interferes due to the coughing, sneezing, or prolonged recurrency. So these patients we have tingling, numbness, and paresthesia, and also areflexia present in this syndrome, and also intramedullary syringomyelia syndrome. So this is we have these patients have pain and affected mainly involved the anterior horse cell, so affected the corticospinal tract. So we have a tenderness present in the spinal process. So investigation we have investigated by the CT scan, MRI, and myelogram and CSF examination. So in management, we have mainly management. We have immediately high doses due to the swelling, and also surgery. We have HCG the tumor, so that is a laminectomy. So this is a decompressive surgery, right? So in physiotherapy management, mainly improve the functional mobility, pain management, and bracing application. Improve strength and flexibility and bowel or bladder management. So first we can see about the functional mobility. So these can educated to the patients and the caregiver, the attender also. So mainly functional mobility first target to prevent any skin lesions like bed sore. So we can prevent the bed sore to apply position. So every 2 hours once we can change the position of the patients. And bed mobility exercise, that is a trunk rotation, and we can do all mat activities. And functional transfer, so bed to wheelchair, wheelchair to bed, be a wheelchair to toilet sitting. So these are, and also we have functional mobility through the gait training also. So pain management, so we have patients have many pains, so apply braces and hot pack application and cold pack application. And also we can give a TENS, transcutaneous electrical nerve stimulation. We can apply where the patient we have a pain, so we can apply the TENS also. And also bracing application, so mainly bracing involved in the postural correction, proprioception awareness and stabilization of the fracture. So we have applied the cervical collar for the that type of soft cervical collar, hard cervical collar. And we apply the TLS, thoracolumbar stabilization orthosis, and AFO, ankle foot orthosis. And abdominal binder also applied to the patient, and also stockings, so compressive stocking to apply in both lower limb. So next, balance improvement, so mainly strengthen the lower limb muscles, so that can improve the sitting balance and also sit to stand balance, and improve the standing balance and improve the dynamic balance. So improve strengthening and flexibility through the program. So first we have muscle power that patients are unable to move, so we give a passive range of motion. And next stage, active assisted range of motion also given. Next, last stage we have an active range of motion. So these movements will improve, so to give the resisted exercise with a weight cuff or a TheraBand or TheraTubes. And also we have we give a stretching for the any muscles can be tight, so that's improve the flexibility also. So bowel and bladder management, we give a pelvic floor exercise, that is a Kegel exercise, pillow squeezing exercise, and bridging. So these three exercises will improve the bowel and bladder. So today we see about the spinal tumor. What are the spinal tumor, classification and management? Mainly our role is to manage the physiotherapy management. Thank you.